So today I want to talk about a type of cancer. We know, like I keep saying, cancer can form in any part. And we know that when we talk about cancer, what can be the cause of cancer? Proliferation of cells, that is cells in a particular part of the body, starts growing out of proportion to normal growth that should occur in the body. But there's this one type of cancer that is sexually transmitted. I call it a sexually transmitted cancer. I'm going to gist us about this type of cancer today. This cancer is seen in women because it affects the cervix, and it's only a woman that can have a cervix. Where is the cervix? The cervix is the lower parts of the uterus, the lower part of the womb. It's like a donut. It's a donut-shaped parts of the womb, the uterus that opens into the vagina. That is where the cervix is located. And this cancer is cancer of the cervix. I'll tell us why I call it a sexually transmitted cancer. Now, like I said earlier on, in other types of cancer, the problem is usually abnormal proliferation of cells. Cells starts growing out of proportion that the body cannot control. But in this type of cancer now, what causes it is a virus, a sexually transmitted infection, a sexually transmitted virus called the human papilloma virus. This human papilloma virus, when it gets into the system, it can stay there for many years. So it can take up to 10 to 20 years before this cancer will develop in the body. It can be there and be causing changes in the cervix gradually. You won't even know. There won't even be any sign to know that this kind of a thing is going on until when it becomes a full-blown cancer. Or if you go for regular screening and then they find out that this change is beginning to occur, and then an intervention can be given at that point. But there is no sign to know that this change, what we call metaplasia, has started happening. So this type of cancer, like I said, it can take several years, 10 to 20 years, before it will finally develop. Now, who is at risk of getting human papilloma virus? The person at risk is number one, someone that has multiple sexual partners. If you have multiple sexual partners, then there is high chances of you picking it up from any of those multiple sexual partners. That is number one. Number two, if you have a sexual partner who has multiple sexual partners. Interesting. What do I mean? Now, this is, let me say, this is Miss A. And Miss A has a sexual partner who is Mr. B. And then Mr. B, for Miss A or Mrs. A, your only sexual partner is Mr. B. But for Mr. B, you have your own sexual partners. You have Miss C, Miss D, Miss E, Mrs. F, Miss G, Miss Y as your sexual partners. You see, it's possible for you to pick it up from any of those sexual partners of yours and come and give it to Miss A, who you are her only sexual partner. Does it make sense? So if you have one sexual partner, but your sexual partner has multiple sexual partners, then you are at risk. I'm sure I've explained that. So I want to say at this point that human papilloma virus has different types. There are over 100 types of it, but there are a good number of them that can cause this cancer in women. So what next do I want to talk about this morning? And that thing I want to talk about today is how can you prevent getting the infection? Because it's when you get the infection, then it will now cause the changes that will lead to the cancer. Number one, protected sexual intercourse. Use of condom. Because when you have protected sex, you protect yourself against contacting this virus from sexual partners. Number two, regular screening. in different locations, there are screening programs that are available that you go for, and it can be picked up if there are these changes that are beginning to occur in the cervix. Also, in some locations around the world, the vaccine is available. Young girls are given this vaccine, the vaccine against human papilloma virus, so that they can be vaccinated against this infection and then against this cancer. So, how can this cancer present? What will somebody see and you say, this is not normal? Number one, unusual bleedings. It can occur as postcoital bleeding. That is, you finish having sex and you start bleeding, especially in advanced ages like 35, 40 and above. Okay, you have to take a look at it. You have to meet your health care provider, meet your doctor. If you are this kind of a person that after sex you start bleeding, that is contact bleeding. Okay, that's contact with the cervix leads to bleeding. So I've talked about bleeding after sex. It can also come as intermenstrual bleeding. That is, between one menses and another, the woman starts bleeding. Okay, it can also come as post-menopausal bleeding. A woman that has reached her menopause doesn't have any business with bleeding from the vagina again. But in some of these people, you see them, menopause has come, they have stopped bleeding long time ago, but from time to time, you see bleeding trickling down from the vagina. You need to see your healthcare provider to ensure that is not cervical cancer, that is knocking on the door. Okay, and then the next sign that you can have, or the next symptom that person can have, is foul smelling vaginal discharge. Clear foul smelling vaginal discharge. Some of these people, they start having vaginal discharge. You know, when this vaginal discharge, you've tried to treat it as normal vaginal infection and is not responding, meet your doctor, meet your healthcare provider. It might not just be an ordinary vaginal infection that is going on. So pain is not usually there, so that you don't say, I'm not having any pain. Oftentimes, there might not be pain. There may or may not be pain, depending on the stage of the cancer. Now, another symptom or sign that the patient might have or the person might have is if the cancer has spread to adjacent organs, that is, structures around the cervix. The person can start having pain. He can have back pain, bone pain, painful urination, and all that. Then you know that the cancer has started getting to surrounding structures. Is there treatment for this cancer? Yes, surgery is available. Surgery can be done, chemotherapy can be given, radiotherapy can be given. Of course, we know chemotherapy is taking in drugs that act against the cancer. Radiotherapy is using radiation to kill the cancer cells that has spread around there. So if you are a woman in your reproductive age, ensure that you meet your healthcare provider and ask for screening programs against cervical cancer in your area. If you have young girls in your house, 13, 14, 15, please check your healthcare provider and know if the vaccine is available in your locality, so that these children can get this vaccine. So thank you for staying tuned today. I'll still see you some other time. This is Dr. Angie saying bye-bye.